get up quietly and make your way to the food trucks. There's going to be 4 different options for food, and you'll have your choice of what you want for lunch. But with that being said, for all those that have already registered, if you could please make your way to your seats. Please make your way to your seats. Please make your way to your seats. As we continue to move forward, our next speaker, this gentleman is the Director of Policy and Equity for Boston Recovery Service Bureau. This individual is a bilingual public health professional with over 25 years experience working in the field of addiction. With an emphasis on harm reduction, he has been employed by the Boston Public Health Commission for over 13 years. Let's put our hands together and let's welcome Heriberto Sanchez. Just before I hand him the mic, para aquellos que no entienden inglés, tenemos los auriculares aquí y pueden cogerlo aquí en el árbol. Raise your hands over here for the headphones. If you need headphones, si necesitan los auriculares y no entienden inglés, pueden recibirlo. Ahí mismito están dándolo. All right. Eddie Sanchez.
Thank you. Hello, everyone. I want to thank MOAR and everybody that's attending today, because this is a real special event. This is like letting folks know that we're out here, all right? My name is Heriberto, but everyone calls me Berto for short. I'm currently Director of Policy, Health, and Equity at the Boston Public Health Commission, Recovery Services Bureau. We do a lot of, at the commission, we help individuals through our resource center called PATHS. We have our harm reduction center, that's A-HOPE. We have our Latino women's program called Entre Familia. We have also Transitions, which is another program for individuals that are seeking further treatment. I want to thank, again, MOAR, Mayor Wu, our commissioner, Dr. I'm drawing, our commissioner at the commission. Sorry about that. I'm drawing a blank, man. And our Recovery Services Bureau Director, Jaika Cardenas. I want to share a little bit because I have been in the field. I know a lot of folks here. It's a big family. We are a big family. And, you know, last Thursday, September 18th, I walked out of a detox 35 years ago. Yeah. And I really didn't know what to expect. I was completely like afraid, didn't know anything, didn't know anyone. First time I had ever went into anywhere. And on my second week there, I found, I was given information from my counselor that I was going to be a dad for the first time. And that really floored me because one of the question he asked me was, what am I going to do now? And I remember I said, what do you mean? And he said, you better do something else. That child is going to follow in your footsteps. And at that moment, I think it just solidified in me the need to become a better person, just so I can be there for my child. And my son today is 34 years old, almost 35, and he's a dad. I have 2 grandkids. I have 5 grandkids altogether. So I'm proud. I love them all. You know what I mean? I have 2 sons. I have 3 sons and a daughter, and proud of every one of them. From the moment I walked out, I just felt the need to help those in the street because I knew I had lost so many friends, and I'm talking through HIV and AIDS, through addiction, through ODs. There was no Narcan back then. We didn't know what to do back then. We didn't have the information on how to conduct rescue breathing. Services were real limited, and if you have to have insurance or pay out of pocket, which was damn near impossible. But, you know, I hung in there, kept learning, educating myself, reaching out, talking to people, and through that whole process, I started getting better and more committed and more committed. And I never in my wildest dreams thought that I would be doing the work that I'm doing, even standing up here right now talking to everyone. I'm nervous, I'm very nervous, but you know what? This is a good cause, you know what I mean? And yeah, it's a good cause. And, you know, not in my wildest dreams did I ever think I'd be doing this type of work or doing this. And every time we lose someone to a fatal overdose, we don't know what they could have contributed to this community. We don't. I just want to put that out there because I always make it a point when I do overdose prevention and Narcan trainings. Even in my role now, I work, and I don't know what my role will be in the future, but I'll always be doing this work, this overdose prevention work, harm reduction work. And the reason I do it is because all life has value. All life has value. And I want everybody to just remember that. Reach out, talk to people. The best folks are right here. The best outreach workers in the world are right here. The best people right here. So give yourself a round of applause, for real. I want to thank everybody for being here. I want to thank MOAR, Marianne Franjulis, who's right there. Thank you. Definitely Mayor Wu, who will be here speaking to you guys also. And our Commissioner Ojikutu, Dr. Ojikutu. I remember the name. I just called it brain cramp, man. But thank you for your time and allowing me to speak. Thank you.
Let's give it up one more time. Hey, he said that the best recovery folks are here. And y'all didn't make much noise when he was talking about that. He was talking about you. Come on. That's what I'm talking about. Referring to yourself. Ain't nobody gonna blow yourself up more than you. You gotta blow yourself up. You gotta talk about yourself. If you're doing something good, you gotta do it good. There's no problem talking about it. Recovery's real. We're making it happen. We continue to make it happen on a daily basis. And with that being said, our next speaker, he's a friend to the recovery community. This gentleman is the Secretary of Health and Human Services as of July 2025, appointed by Governor Mayor Healy. Maura Healy. That was bad. A practice physician specializing in addiction and primary care, he has served as Undersecretary of Health and of the EOHHS since April of 2023. Previously, this gentleman was the CEO of Lynn Community Health Center. Please, let's put our hands together and let's welcome Dr. Mahania to the stage.
You have to eat the microphone. Keep it so that they can hear you all the way back in the feed.
Thank you, Noel. As a person who has a complicated last name, I admire somebody who can pronounce my name the first time like that. So that's great. I am honored and touched to have been invited to give a few comments here today. Thank you all for being here to celebrate the lives saved due to recovery. Thank you to MOAR for the 35 years of advocacy and for bringing us together today. So again, one more round for MOAR. As Noel mentioned, long before I was appointed by Governor Healy to be Secretary of Health and Human Services, I trained as a family physician. 20 years ago, I moved my focus from primary care to addiction medicine. And why did I move my professional work to addiction medicine? It's because I was struck by the incredible lack of compassion that people with addiction faced when they encountered our system. As a physician, I've had the honor of being a trusted healer for my patients and their families. I see the lived reality of substance abuse disorder for my patients and their families, and I see and I admire recovery up close because I know that recovery isn't easy. You know the power of when communities come together to support access to life-saving treatment and care. And this care can come in many forms: in access to treatment and recovery services, in access to harm reduction supplies, in access to housing, healthcare, and other basic needs, and sometimes just in the form of a friendly, supportive face. Despite national shifts and confusion at the federal level, I want to reaffirm that the Healy-Driscoll administration will continue to support and expand access to public health tools and evidence-based approaches to promote dignity for those who use substances, to reduce harm, and to champion recovery. But more importantly, on a more personal level, in these dark days when people are being othered, whether because they're poor or because they're living with disabilities, or they have the wrong paperwork, or those who are unlucky enough to have no home, those are all being treated as disposable, as undesirable, less than human beings. In these dark days, as Secretary, I will use whatever authority and influence I have to ensure that those who are on the spectrum from active use to recovery are treated with dignity and compassion. Thank you for inviting me here, and I think Noah was going to sing a song for us. Is that what I heard? I heard he was singing a song today. So if you want a song from one of the best singers in Boston, put it together for Noah.
I think there's some conniving going on out there. Somebody put him up to that. Oh. Let's put our hands together one more time for Dr. Kyame Mahania. All right. Our next speaker is the mayor of Boston, daughter of immigrants, Boston Public School, mom to 2 boys. Let's put our hands together and let's welcome Mayor Michelle Wu. I'm good. How are you?
Thank you so much, Noel. Good morning, everyone. Are we ready to march today? Are we ready to help everyone take a step forward in the road to recovery? And are we ready to make sure that this is a city, a home for everyone in Boston? Thank you so much for being here every single year. I know it's been all sorts of weather throughout all the years, and we've been in different locations, whether it was starting inside, coming out, outside, going over. This is an incredibly beautiful setup this year, and I so appreciate everyone from MOAR and all of the partners here for making it possible, and most of all, to all of our community members for coming out and making this real. So thank you. Thank you to Dr. Mahania for all that you do and all of the partnership from the state. We are grateful for everyone coming together every year to celebrate the progress made, the lives saved, and also to remember and honor those we've lost to substance use disorder and to reaffirm our dedication to continue closing these gaps and keep moving forward. So to all of our partners at the state, to all of my colleagues and those who I'm blessed to work alongside at the city level, from Dr. Pasola Ojukutu of the Boston Public Health Commission, to Jaika Cardenas, Director of BPHC's Recovery Services Bureau, Heriberto Sanchez, BPHC Recovery Services staff, and everyone at BPHC, thank you for always stepping up to center our community and to work to do everything we can in the city of Boston. We are working every day to make Boston a home for everyone. That means everyone. And thanks to the leadership of all of the partners and all the community organizations, we are proud. Although the work is not done, it's important to mark when we have taken big steps forward. And so we're proud that in 2024, Boston saw the fewest opioid-related overdose deaths since 2015. That's nearly 40% down between just 2023 and 2024. Every single life saved, every overdose fatality prevented is another family that continues to love their loved one tightly, another kid who can play catch with their parent, another mom or dad who can rest easy knowing their child is safe. And that is what this work is all about, making sure that we are connected to each other in community, with joy, with resources, and making sure that everyone is healthy in every block and every home. Now, while we've made progress, even one overdose death is one too many. Because being a home for everyone means making sure that all our residents have the opportunity to live long, healthy, happy lives. And research shows us, and community tells us, that bystanders, those family, friends, and neighbors, are 98% successful at using naloxone to prevent a fatal overdose. So just in the last year, the City of Boston provided more than 200 free rescue trainings for Boston residents, training more than 3,000 people to administer naloxone and protect their neighbors. We continue to do that all across the city. In Mattapan, our 2 residential treatment programs empower people struggling with substance use disorder on their healing journey. In East Boston, we partner with Neighbor Health to launch our 6th public health vending machine that has everything from test strips and naloxone to socks and blankets. And all across Boston every day, we're distributing these life-saving resources and doing street outreach all across our city. We know that addiction is incredibly difficult to overcome, and it can feel like it just sits and waits for that moment of vulnerability, that moment where our support system falters. In Boston, we will not let those moments win. We will not let addiction win. We will use every tool possible to support our residents in recovery and in the loved ones and the families and communities that they need to continue on recovery. So to everyone who has a friend, a family member, or a loved one in recovery, to everyone who is one of our heroes and champions who are in recovery, thank you. Thank you for what you do. Thank you for being who you are. Thank you for lifting up our city and making Boston the amazing place that we are. So congratulations to all who are on this road. This is not a road you walk alone. And today we're going to walk and make a lot of noise while we're doing so.
Thank you so much.
Let's give it up one more time, Mayor Michelle Wu. All right, all right. Are you ready? That was real weak. I'm sorry. Are you ready? All right. What I'm going to ask you to do is stand up from your seats and make your way to the bandstand. We have some folks that are back there that are getting ready to lead all of us in a march around the Commons. We're going to make some crazy noise. We're going to let the city of Boston know that recovery's real. And as we go forward, we can go forward saying, hey, hey, ho, ho, recovery is the way to go. Come on, let's go. If you have your banners, bring your banners with you. You can carry your center banners with you and let the community know where you're from. I know we have Central Mass Recovery Support Centers. I know that we have Western Mass. I know that we have Southeast, North, Northeast. Bring your banners with you.